Hi there. Thank you so much for completing the first part of my study. My name is Sydney. I am a current student at the Union Institute and University. I am earning my degree in Masters of Arts of Applied Dietetics and Nutrition. And when I finish my degree, I'll be becoming a registered dietitian. So that is, of course, why my thesis topic in this study is regarding diet. Now I will be providing you lots of great detailed information regarding diet's relationship to acne based on tons of research, and I'm going to be especially focusing on the Mediterranean diet and its relationship to acne. All right, let's dive in on the Mediterranean diet and adult female acne. The Western diet is commonly followed among developed countries, including America. It is unfortunately associated with acne, and this is for a number of reasons. One of them being due to the high intake of simple carbohydrates. Simple carbohydrates break down in the body extremely fast, resulting in a spike in the blood sugar, spike in insulin release, and also a number of other processes which lead to acne development. Simple carbs include white potato, white rice, pastas, bread, and also cereals and chips. Another issue with the Western diet as far as acne development goes is that it's highly inflammatory. This is due to the high intake of omega-6 fatty acids, which are considered pro-inflammatory. So we're getting a lot of omega-6 fatty acids when we're consuming a lot of processed foods. We're also not getting a lot of omega-3 fatty acids, which are considered anti-inflammatory and are found rich in walnuts, chia seeds, and especially in fish. Both omega-3 and omega-6 polyunsaturated fats are essential to the diet. However, it is the disproportional amount of omega-6 that we're getting compared to omega-3 that is causing issues for us, including acne. The Mediterranean diet, on the other hand, is pretty much opposite to the Western diet. It has been shown to be effective at both treating and preventing acne. And in the Mediterranean diet, foods with lower sugar are consumed, and more complex carbs compared to simple carbs are consumed. So on the westernized diet slide, I went over the dangers of the simple carbs. Just want to remind you, it's because it breaks down in the body so quickly that it causes that blood sugar spike and the insulin spike. Complex carbs tend to have fiber in them, which is going to help keep your blood sugar regulated throughout the day. It's not going to cause those rapid blood sugar spikes and insulin spikes. The Mediterranean diet is also very high in omega-3 fatty acids and low in omega-6 fatty acids. So it's an anti-inflammatory diet for sure. Here I included a chart of the Mediterranean diet and the westernized diet side by side. As you can see, the Western diet is high in desserts, sweets, processed foods, moderate in high-fat dairy, refined grains and potatoes, and low in whole grains, veggies, legumes, and fruit. The Mediterranean diet, on the other hand, is low in sweets, potatoes, processed meats, and food, and high in fruits and veggies, whole grains, olive oil, and then more moderate in the nuts, eggs, seafood, fish, white meat, etc. Another component to the Mediterranean diet is there's a high intake, or moderate intake, I should say, of red wine. That is the alcohol of choice when following the Mediterranean diet, and that is because of the resveratrol that is found in the red wine, which can act as an antioxidant in the body. Here is a diagram which can show you the steps of the pathogenesis of acne. So if we look on the bottom here, we see increased GI/GL. GI/GL stands for glycemic index or load. This refers to a food's ability to raise your blood sugar. Then we look to the right of that, we see dairy. So when we're consuming foods with high GI and dairy, this causes the blood sugar to raise, which results in an insulin production, resulting in upregulation of insulin-like growth factor hormone, a downregulation of FOXC01 transcription factor, and an upregulation of mTORC1. That might sound confusing, but basically what I'm trying to show you is there's a series of steps that go on after you consume these foods that are going to cause the production of acne. If we look at the omega-3 fatty acids, we can see that it's essentially the opposite. When we consume foods high in omega-3, such as a piece of fish, this is going to downregulate the insulin-like growth factor hormone and the leukotriene B, causing anti-inflammation and anti-acne. So that helps prevent acne, whereas the other ones do the opposite. Alright, so acne is extremely debilitating for those enduring it. It can result in depression, anxiety, and social shyness. It might not be life-threatening. It's definitely not a chronic condition on its own, but it is extremely, like I said, debilitating for those enduring it and can result in problems within your personal life and your work life. So it affects about 85% of adolescents in Western populations. Teenage boys suffer more than teenage girls, but it flips as we get older. Women suffer at higher rates than men. And this is due to the hormonal component with the acne. So as women, our hormones are constantly fluctuating, whether it's our menstrual cycles, pregnancy, premenopause, menopause, but then also other conditions such as PCOS and endometriosis, which only females can get. There are populations with no acne prevalence, and when looking at what these populations have in common, what researchers have found is it's their diet. So these populations are following Paleolithic diet conditions, which are extremely similar to the Mediterranean diet. They're high in whole foods, and there's no consumption of processed foods as they are underdeveloped and they don't have the opportunity to. There's also a condition with no acne prevalence known as Laron syndrome. So when those with Laron syndrome have been treated with insulin-like growth factor 1 hormone, acne has emerged, which further solidifies the relationship between IGF-1 and acne. As we know, our diet can directly impact IGF-1. Acne sufferers should be aware that increased signaling of the mTORC1 is a predictor of obesity, type 2 diabetes, Alzheimer's, and cancer. Those with Larons have lower rates of acne and also a lower incidence of diabetes and cancer, interestingly enough. Your skin is the largest organ of the human body. If you're suffering from acne, you should really consider, what's going on with your internal organs and how is your future health going to suffer, or how may it suffer. So by now, you probably know that foods within the Mediterranean diet are beneficial for the skin, whereas foods within the Western diet are detrimental to the skin. Here are some specific nutritional relationships which have been found through scientific research. So dairy has been shown to be aggravating to the skin and causing development of acne. It does, however, depend on the type of dairy consumed. So skim milk, low-fat milk, ice cream, and whey protein have all been linked to the development of acne, whereas whole-fat milk has not been. Chocolate is controversial. It may depend on the form of chocolate consumed. Some studies do point to all chocolate causing acne, but overall it's an area needing more research. Vitamin B6 and B12 have both been linked to the development of acne when consumed in excess. So usually that happens if you're supplementing with it because you don't get a ton through the diet. Acne healing foods and nutrients, on the other hand, are green tea. So green tea has polyphenols and antioxidants which are beneficial to the skin, and fish has lots of omega-3s which are good for the skin because of the anti-inflammation, and supplementing with zinc has been shown to be helpful for acne sufferers. Since zinc deficiency is relatively common, it is a good idea to supplement with zinc if you suffer with acne. Vitamin A is an antioxidant which has been shown to decrease acne severity. Interestingly enough, the main ingredient of Accutane is vitamin A. Accutane is the most powerful last resort acne treatment drug there is, to my knowledge. So it's a good idea to supplement with lots of vitamin A if you are suffering with acne. If you're interested in following the Mediterranean diet and seeing how it may improve your skin, I encourage you to enroll in the next part of my study by emailing me. What you'll do is you'll follow the diet for 1 month, contact me whenever you need in between, and at the end of the diet, I will follow up with you and see how your skin has improved. Please exit out of this video and go back to the SurveyMonkey link so you may complete your pre-test survey. If you have the time, you can feel free to go ahead and complete the post-test survey. If you want to do it at a different time, you have up to a week to submit it, and I will be sending a follow-up email for that. Thank you.